Another question that I am frequently asked is about coverage that somebody has through their former employer or their spouse's current employer or former employer. And I got asked it today, as a matter of fact. Somebody called and said, my wife is a retired school teacher. I'm turning 65. Should I continue with their coverage or should I go out and get it on my own? And that's a loaded question that there's no easy answer to unless you have all the information you need. Sometimes it's an easy answer. I met with a guy the other day. The coverage that he got through his former employer was some of the worst coverage I've ever seen. It was basically an indemnity policy, which is the old school way of health insurance coverage. He had a suitable Part D plan, but the hospital and medical, I mean, it covered very little. But the gentleman who called me today was a sharp guy. And I said to him, well, if you leave that coverage, can you get back into it? And if you wanted to, he didn't have that answer. And he couldn't locate that answer. Nobody seemed to know it. But more importantly, I said to him, well, how much is that coverage going to cost you? He didn't know that either. He knew that his wife wasn't paying for coverage, but there sounded like there was some cost to him. So that's one thing you need to know. How much is it going to cost you? You also need to know the benefit structure. What are the benefits for the hospital coverage and the medical coverage? What does it cost if you are an inpatient, if you're outpatient surgery or just outpatient in general, if you go to doctor's visits, ambulance, all those things. You need a benefit summary at the very least. And you also need to know about any extra benefits or what the drug benefits look like, because usually that's the main difference. The Medicare drug plans have some holes in it, if you ask me, depending upon the types of drugs and that you take. However, if you take expensive drugs, there are deductibles, copays, but more importantly, there is a coverage gap. And if you're susceptible or don't have a way around that, that can leave you exposed financially a little more than you may be accustomed to when you're not on Medicare. So that's a concern as well. If you're staying on a retirement plan and they're not going to give you a bona fide Part D drug plan, you may have coverage that is a little better than the Medicare Part D plans, if you ask me, because many of those major meds don't have coverage gaps. However, you really have to do the math. So I asked him if he could supply that information. He said he couldn't get it. I said, if you would like, I'd be happy to do a three-way call with the HR department, you and myself. I have a way of asking the right questions. This is what I do. So once you have all that information, what is it going to cost for the plan? What is the benefit summary, hospital, medical, and drugs? And then we compare that to the open market. And when we have all that information, and can you get back into the plan if you wanted to? Once you have that information, it's relatively easy to make a decision. Not always, but relatively easy. If it's close, I usually suggest staying with your retirement plan. But it's a case-by-case basis. I hope that helps you.